pressure pad alarm method. The Microtech Sentinel is designed for a 45-day, 180-day, and 1-year pressure pads for the bed and 1-year pads for the chair. The pads can be disinfected with most common cleaners, but should not be immersed in any liquid. The pads should also not be used past their stated lifespans. If you're only using pressure pads for resident monitoring, change the cord and clip assembly to the Microtech key fob. This will allow manual reset of the alarm without the cord and clip getting in the way. Every bed will have sheets on it, and perhaps a wetness liner. When you place the Microtech pad onto the bed, place it under the sheets or the wetness liner, but always on top of the mattress. The pad should be positioned across the bed from side to side and be under the buttocks area. Do not place the pad vertically down the center of the bed. The pad should be used only with a person who weighs at least 70 pounds, otherwise the pad may not operate properly. When the pad is in position, secure the mattress sheets back onto the bed. Run the cord along the mattress and bed frame. Be careful not to allow the cord to get in the way of any moving parts of the bed. This could pinch or sever the cord and prevent the system from operating properly. Take the end of the cord with the telephone-type connector and plug it into the jack on the bottom of the Microtech Sentinel labeled pad. Listen for the mechanical click to make sure it is securely attached. If you want to have the Sentinel alarm at the nurse's station, as already mentioned, you will need to interface your monitor with the nurse call system. Use the 1/4-inch phone plug on the optional nurse call interface cord and plug it into the bottom of the Sentinel monitor where it is labeled nurse call. Plug the other end into one side of the optional Y adapter and the nurse call button into the other side. Plug this assembly into your nurse call system. You can now attach the Sentinel to the resident's bed. When using the metal bracket, place the face of the monitor toward the wall away from the resident. Remember to place it on the left or right side of the patient's head, not directly behind it. The system is now ready to go. Anytime you prepare a fall monitor system for a resident, you must test it to make sure it operates properly, sounding an alarm in the room and an alarm at the nurse's station if applicable. Place your hand on the pad and press down. The Microtech Sentinel will chirp to indicate the pad has sensed the weight. When you take your hand off of the pad, the monitor will go into alarm and confirm that the system is working. If the patient lies back down or self-corrects after setting the monitor into alarm, the monitor will reset itself. If the resident gets out of bed and you have to reset the alarm, simply pull the key fob from the front of the monitor and replace it to reset the alarm.